Hello everyone, welcome to Grey Matter, your one-stop to all your exam preparation needs. As you know that we are talking about the UKMLA content map and we are going through each and every aspect of the content map in detail. Today the topic of our discussion will be the general practice and primary health care. Now, this is one of the most important topics that are present in the UKMLA exam, and most of the stations, if not about 6 or 7 stations, will be from this category. So you need to master these symptoms, you need to master these presentations, you need to master these conditions. Abdominal distension, a patient can present to you with abdominal distension. You need to order investigations such as LFTs, because most likely it is carried out due to some problem in liver, and this station usually comes as form of examination station. So this is a examination station. Abnormal eating or exercising behavior. Now, this is one. This can come in the form of anorexia nervosa or bulimia nervosa. We have already discussed that before. Abnormal urine analysis, we have discussed it before. There's some problem within the urine sample. There's some problem with the urinary results. It can be an increase in pus, increase in crystals, so increase in glucose, anything like that. Acute abdominal pain, we have discussed. Any abdominal problem include peptic ulcer disease or pancreatitis, appendicitis. It is all included in the abdominal pain. Acute and chronic pain management, this is one of the most important topics, because the pain management, it usually comes in the form of Simmons stations where you have to manage the pain, but it can come in the normal consultations where the patient is in severe pain. Now remember, it can come in the form like during the start of the consultation, the patient will be in severe pain and he'll be like, doctor, I cannot continue the discussion until you relieve my pain. So you need to give the patient the painkillers to relieve the pain of the patient and then later continue the conversation. Acute joint pain swelling, this is from rheumatology. It can be due to a number of causes involving rheumatology. Acute rash, it can be due to allergy, most likely allergies, same. It can present as a rash or SOB or swelling. Anxiety, phobias, OCD, these are part of psychiatry, and the patient usually presents with a shortness of breath in case of anxiety. It can be a panic attack. An obsessive compulsive disorder, the patient will reportedly repeatedly do the act. The back pain, another important topic. Behavior personality change, psychiatry. Bites and stings, they usually come in the form of allergic reaction. Bleeding from lower GI, we have discussed it in the previous topic. Breast lump, now this is an examination station. A patient can present to you with a breast lump, and she is worried because one of her relatives has been diagnosed with breast cancer, so now she is worried. So this comes in the form of examination station. Breast tenderness, pain, same. The patient, this came in my exam, the breast tenderness and the pain. The mastalgia, the pain is localized to the breast, and there is no particular swelling in the breast and no discharge from the nipples. Breathlessness, it can come in the form of COPD, asthma, or some cardiac issue, or as simple as allergy. Change in bowel habit, it can be diarrhea or constipation. Chest pain, typical angina or MI. Chronic abdominal pain, we have discussed it. Chronic joint pain, already discussed it. CKD, now it is a chronic disease. The GFR, the creatinine, that will be raised, and there will be deranged RFTs along with proteinuria and swelling. Chronic rash, constipation, discuss it. See, as you notice that most of these topics are repeated in the presentations. The cough, a very particular topic, that a particular presentation that you face in the GP setting. A crying baby. Now, this can be due to fever, this can be due to an ongoing infection, or simply because the baby is in pain, or there might be nothing wrong with the baby and the mother is worried, and you would have to counsel the mother. Deteriorating patient, this is mostly in the Simmons stations. Whenever, remember, in all the presentations that you get in the uh, non-Simmons stations, they are always stable, they're not deteriorating. Diarrhea, we have discussed it. Dizziness, it is a common, it is usually associated with ENT. Driving advice mostly comes as part of some other not only as a simple GP advice. It comes as person suffering from some disease, and you have to give the advice of driving to the patient. Ear and nasal discharge, which is flu, erectile dysfunction, that can be due to some medications that he's taking, or that can be due to stress. Eye pain and discomfort, that can be due to some infection or can be due to trauma. Facial periorbital swelling, it can be due to deranged kidney functions. Falls, it can be due to a mechanical fall, or it can be due to an hypotension, orthostatic hypotension. Fatigue, generalized fatigue, fever, fit nose. Now, this is a very important one. The patient comes to you because she's asking for a fit note, and her baby is sick, and she needs to take care of the baby. She does not have a partner with her, and she's healthy, and she comes to you, and she wants a fit note so she can go home and take care of her baby. And so remember, in such stations, you never give the fit note because it is unethical, especially when the patient is fit. Now, hematuria, hemoptysis, this is usually involves the kidney disease, and hemoptysis, this usually involves your COPD or cancer, lung cancer. Headaches, we have discussed. Hypertension, we have discussed infant feeding problems, we have discussed loss of libido and low mood. These are all psychological problems. Now, the conditions that these presentations can come in are acne vulgaris, which is a part of dermatology problem. Acute bronchitis, this occurs in pediatric cases. Pediatric patient who presents presentation similar to asthma. Acute stress reaction, and this is most likely due to an ongoing infection or allergy. Allergic disorder, same. Anemia, any underlying cause of anemia. Anal fissure, the patient will have he will not let you examine the backside because it will be so painful. Anaphylaxis, same. Anxiety disorder, we have discussed. Arrhythmias, cardiac issue, asthma, we have discussed. Atopic dermatitis and eczema, these two are correlated, because whenever atopic dermatitis is present, always think of asthma. Atrophic vaginitis and bacterial vaginosis, this will be more discussed in gynae, and patient usually comes with foul smelling discharge. Bell's palsy, neurological cases, facial deviation on one side, benign eyelid disorders, benign paroxysmal position of vertigo, ENT. Benign prostatic hyperplasia, this usually comes in the form of a patient requesting prostate PSA testing. Breast abscess, patient comes with discharge from the nipple or redness over the breast and pain. Bronchiolitis, bursitis, then this is the inflammation of the bursa, usually involving the knee. Candidiasis, usually whitening of the tongue, and the patient will come chronic steroid user, usually father bringing the child who is using inhalers. Chlamydia, a typical sexually transmitted disease. Chronic fatigue syndrome, this is simple pain patient is experiencing without any particular cause. CKD we have discussed, COPD discussed, conjunctivitis discussed, and the rest are mostly the similar. The crow, again, this is a pediatric case, and you have this Crawley cough present. Cutaneous fungal infection, cutaneous warts, these are dermatological causes. Dementias and depression, very important. If I need to say, these two topics are very important. Diabetes we have discussed in previous cases. and disease screening, diverticular disease. We have all of these topics we have discussed in the previous topics. So there is nothing new present in the topics that are included in the general practice, because most of the topics the GP concludes of all the topics that are present, or the presentations from neurology, from gastroenterology, from all the number of different departments. They usually first present to the GP, so all of those presentations can occur in the GP practice. For today, this is enough, and I hope that you have gained some insight into the UKMLA.